Hi, I'm Frank Yiannas, host of the Smarter Food Safety Podcast. Thank you for joining us. Food safety is critical year-round, but every summer we tend to see an increase in foodborne illnesses. Warmer weather, changes in food sources, food consumption patterns, international travel, and other factors can create conditions where certain pathogens become more prevalent. But let's be clear, this summer, the summer of 2026, well, it's been quite different. Cyclospora moved from being a relatively unknown parasite to a household name. Salmonella, an old foe, continue to cause outbreaks and remind us that some of our oldest food safety challenges remain with us today. And beyond the frequency of outbreaks, we saw something equally important. Questions about the strength of prevention efforts. How quickly can we detect illnesses and connect them to cases or a common food source? How quickly can we trace food back through complex supply chains? And how well do we communicate with the public along the way? All of that resulted in, sadly, I believe, a decline in consumer confidence and trust in the safety of our food supply. And those are just some of the things I hope to explore today. This isn't about Monday morning quarterbacking or finger pointing, I assure you that. It is, however, about taking a constructive, critical look at what the summer of 2026 can teach us all. What did we learn? Were there gaps in the system? And most importantly, what can we do differently before the next outbreak occurs? For today's discussion, I'm pleased to be joined by Dr. Craig Hedberg, a professor in the Division of Environmental Health Sciences at the University of Minnesota's School of Public Health. Before joining the university, Dr. Hedberg spent 15 years at the Minnesota Department of Health, where he led the foodborne disease unit and oversaw dozens, literally dozens of foodborne outbreak investigations and served as a role model for the nation. I've had the privilege of working with Craig while at FDA and also during my career in the private sector. So I'm excited for a conversation today about the summer of 2026, Cyclospora and Salmonella, and the lessons we shouldn't leave behind when this summer is over. Let's get started. The Smarter Food Safety Podcast is sponsored by Ecolab, a trusted partner throughout my career. They're dedicated to protecting what's vital by advancing food safety, ensuring clean and safe environments, and enhancing water quality around the world. Well, hey, Craig, it's so good to see you again, and I'm excited about having you on the Smarter Food Safety Podcast. Thank you for joining us.
Well, it's my pleasure.
Craig, I always enjoy time with you talking about food safety and outbreaks. And, we've titled this The Summer of Cyclospora and Salmonella, Lessons Learned. Craig, I've only used a term for a summer once before. That was the summer of 2008. I called that the summer of salmonella after salmonella and originally what we thought was Roma tomatoes and then jalapeno peppers. Never coined another summer before, but this summer has been quite different. I think you'll agree. Let me begin. In the intro, I told the audience that this isn't about fault finding. We're not finger pointing. We're trying to be critical, but we are trying to discern, are there any lessons learned here that we should be thinking about as we go forward? And the other thing before we get started, I want our audience to know, I told them a little bit about your background, but what I didn't share was that you and I have worked together. When I was at FDA, I actually hired Dr. Craig Hedberg to come in and do a review of FDA's foodborne outbreak investigation and response. And he wrote a report. If you want to see it, it's distilled down now into something that we published called FDA's Foodborne Outbreak Response Improvement Plan. It's still on our website. And so you interviewed, I think, dozens of people to help us get that report out the door. And we hope the agency continues to work on that. Knowing that this summer was different, we know that there's seasonality of foodborne illnesses, and they tend to see, or we see more in the summer, Craig. This summer felt different. What do you think are some of the factors that made 2026 feel different than years past? And do you agree that 2026 felt like a different type of summer?
No, I think the summer has been overwhelming in many respects. And, I think Cyclospora obviously was a huge part of that. And we had this unprecedented, massive outbreak of Cyclospora infections across the eastern part of the United States at levels, that we've actually never seen before. And I think there's several reasons why sort of this perfect storm occurred. and they include some artifacts of how we conduct surveillance for foodborne illnesses, how physicians diagnose infections with potential foodborne illnesses, and something about the nature of the food item that was contaminated with Cyclospora and how it was distributed.
And again, not to be critical, do you think it exposed any underlying weaknesses in our food safety system?
Well, I think, it highlighted things that we know are potential problems. One is, we have a food system that is very complex and features a lot of high volume distribution of food products. So we had with the Cyclospora outbreak a production source down in Mexico that gets distributed across half the United States. That level of concentration and distribution is something that we know comes with it the risk that if something goes wrong in the system, it can have a very big impact. And obviously, something went wrong in the system, and we don't know what it is. And I think, we're talking about lessons learned. Some of these lessons, I think, will only become clear to us down the road when all of the information that we can possibly learn can come together. But simultaneously with the distribution of lettuce coming out of Mexico, we had distribution of jalapeno peppers coming out of Mexico that caused a large outbreak of salmonella that was, associated with the distribution of jalapenos across much of the mid and western part of the United States. And so these things happening sort of at the same time just further cause concern in the public. And layered on top of that was, of course, a very large recall and outbreak of salmonella associated with
Right.
shell eggs. These are all things that we've seen before. The scale of some of them, was larger than we've seen before, but they are all problems that we know and recognize and need to figure out better strategies for managing.
Got it. Thank you for that, Craig. Couple of things that jump out at me is 2026, you said, has felt significantly different. So I think
Yeah.
folks that have been doing this for a while, folks like you and I, veterans, say, well, 2026 was different. We just can't explain this away. We need to pause and investigate and understand why it happened. But you said the scale of today's food system,
Yeah.
right? And products distributed very broadly. One of them was a unique parasite that, people hadn't heard of, and now it becomes a household term. Multiple pathogens at the same time
Mhm.
causing outbreaks. And then you say things that we've seen before, which I want to come back to because it's troubling. Because, I know in the report that you helped develop for the FDA, one of the central features was, we need to continue to work on further advancing root cause investigation so that
Right.
we don't see these things over and over again. Salmonella in eggs, salmonella in cantaloupe. So let's pivot. That's just an overview of the summer of 2026. But I don't want the summer 2026 to be over with and us move on. I want us to prevent something like this in the summer of
Right.
2027. So let's just dive into cyclospora in a little bit more detail because this summer in cyclospora was different. When I was at the agency, we would track the number of cases. I would ask for numbers weekly, Craig. I want to know
Mhm.
how many cases are reported nationwide this week compared to last, because I wanted to be on top of it. And this year, that escaped us. We didn't get weekly reporting early on. Eventually, CDC started reporting on a weekly basis. That's great. I went on the website this morning before we did this podcast, and I saw there are now close to 14,000 laboratory
Get 'em.
confirmed cases, 10,000 that require additional investigation. That's at an order of magnitude significantly above what we've seen in years
Yeah.
past. Why do you think that happened this year? And what do you think are the lessons learned specifically with Cyclospora?
Yeah, well, Cyclospora, I think, well, there's several things. One is, Cyclospora is a parasite. We can't grow it in the laboratory like we do with Salmonella or E. coli. So detection of Cyclospora either requires the microscopic examination of stool to look and see the actual organism, Or recently, there have been developed these PCR-based tests to detect the presence of the organism, and there are a number of what we call culture-independent diagnostic tests that have panels of different organisms that are tested for. Some of these panels include Cyclospora, and so we've greatly increased the ability of clinical laboratories to rapidly detect the presence of Cyclospora. So I think those changing laboratory practices at the clinical laboratory level have increased detection and reporting of Cyclospora, and that would happen independently of the events of 2026. We've seen increasing trends in Cyclospora reporting just because the tests are more readily available. So that's one big piece of it. The other thing is that recent budget cuts to food safety activities and program activities at CDC have meant that they have fewer staff who've been tasked with sort of the routine surveillance activities for tracking things like Cyclospora. Cyclospora is reportable in 47 states in the United States, and when cases get reported to the state health department level, then that information gets forwarded to CDC. But because resources have been tight at the state level and tight at CDC level, that flow of information hasn't been happening as quickly as we've seen before. So then all of a sudden we have this explosive outbreak involving literally thousands of cases. And it's been a challenge for the individual states and local health departments to keep up with that flow of cases coming in, to be able to interview them, document the illnesses, and then forward that information on to CDC. Like you say, we're used to dealing with hundreds of cases
Right.
over the course of a summer. This year, we're dealing with many thousands of cases.
Right.
So just the volume of information has been a problem to manage.
Yeah. That's interesting as I hear you speak. Certainly, we do think our ability to diagnose illnesses is getting better because,
Yeah.
as you said, there's more screening. And I think because there were more illnesses, one might suspect, well, doctors were sending off patients to get tested more frequently. So that's contributed. But I don't think it explains the scale of what happened. It contributed to.
Yeah, I think the scale of what happened is really the characteristic of the food item that was contaminated. In past years, we've seen outbreaks of Cyclospora associated with cilantro,
Right.
parsley, little snap peas, raspberries. These are food items that are not widely distributed and consumed by massive amounts of people. They're sort of more niche type foods that have, sort of more limited distribution patterns. All of a sudden, we have shredded lettuce, and lettuce is one of the most commonly eaten vegetable items in the population. CDC has done studies looking at population in FoodNet sites to see how common different food items are. And it's about 80% of the population will eat lettuce in a given week. It's a very
Right.
common food item.
Right.
So all of a sudden, you have a very common food item distributed through a very popular chain of restaurants that a lot of people are being exposed to, and that rapidly produces a very big outbreak. The other thing about this is that the infectious dose of Cyclospora is small. And
Right.
in previous outbreaks, between probably half to 90% of people who ate the contaminated food item are going to get sick. So we have a very low infectious dose. We have high attack rates.
Attack rates. Yeah.
And then we have a food item that is widely distributed and consumed. And all of those things come together in unique ways that we haven't seen with food items in previous outbreaks.
Yeah. 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 It's scary to think about how many illnesses might be occurring across the nation. And the last estimate of underdiagnosis, a paper
Yeah.
that the CDC published a while ago, I think the factor was 83. We think it's lower now, but nevertheless, if you do the math, reported cases versus unreported and how many cases might be out there, it's a large event. And there's clusters that have not been identified Greg, maybe one more
Yeah,
thing, and we'll move on from Cyclospora on to Salmonella, the other foe this summer. Our inability to have something like WGS, molecular
right.
subtyping, has been really an issue, right? Because we've got a handful of clusters where we don't even know the food. We might not know the food by the end of summer.
No, that's true. With Cyclospora, we have really limited ability to do the kind of sequencing of the organism to say that any two isolates are likely to be related to each other. So we basically, just say it's Cyclospora, and we're trying to look for exposures that might be common between cases. And that's a challenge when there might be 10 different sources of Cyclospora active across the nation, and we can't tell whether any of these cases might be related to each other. So we
Right.
go in, sort of a little bit blind to see where patterns of exposure similarities really can guide our investigations. With Salmonella, we can do the whole genome sequencing. We can tell very clearly which organisms are likely related to each other.
Right.
Cyclospora, the CDC does have methods to begin to do some sequence typing. The problem is they're not really widely distributed across public health laboratories, and they're limited in how many isolates, how many
Right.
samples CDC can process, and
Yeah.
processing isn't happening in real time.
Right. Yeah.
So a year from now, we may know more about how those organisms related to each other, but we don't have that information to guide our investigations.
Yeah. Yeah. Great comments. When is a cluster really a cluster without those molecular subtyping techniques?
Right.
And I know the CDC is jammed. We're grateful for the work they're doing, but
Yeah.
I've heard reports from states sending specimens to CDC and having to wait because the lab just doesn't have the
Yeah.
capacity. And
Yeah. So, I mean, in this particular outbreak, as Michigan public health officials started interviewing people in Michigan, they very early on got a signal. A very high percentage of the cases they were talking to had a history of eating at, the Taco Bell restaurants. That signal, sort of drove much of the rest of the investigation. And rapidly detecting signals like that is important for early interventions.
right. Yeah. Lots of debate. Like I said, we're not going to Monday morning quarterback, but some people think those signals were detected early. Could have there been more rapid
Yeah.
action? I think when the summer is over, we'll investigate that. Let's pivot to salmonella because, like I said, that's the other thing we've seen
Yeah.
this summer. We've seen it in summers past, but we've seen multiple outbreaks, and it's been a stubbornly persistent pathogen for years. How do you think you already alluded a little some similarities. What was different with the Salmonella and Cyclospora outbreaks, and what was similar?
Well, one of the things that was similar was, the cases were occurring over the same time frame. And, sort of that period in July, we were seeing a lot of illnesses coming in with Cyclospora, and if you look at the distribution of case onsets for the Salmonella associated with jalapeno peppers, it looks a lot like the epi curve for the Cyclospora outbreak, and some of that is just related to the distribution of the contaminated jalapeno peppers. They also were coming out of Mexico, and so the different distribution networks, different sources of production, but a common problem with probably environmental contamination that led to the product being distributed very widely. And then, again, because jalapeno peppers are in food items, salsas, guacamole, things that aren't being cooked before they're eaten. It's another example of a fresh produce item that gets contaminated and is a nice delivery mechanism for
Right,
pathogens to people.
right. Stealth ingredient. Yeah.
Yes.
So those were similarities. Anything different?
Yeah.
They both came at a same country of origin. Want to be careful with that because, we can't just default and say food safety is another country's problem. We have a lot of outbreaks that are documented with foods produced in the US.
Absolutely.
Attribution to produce. two different parts of Mexico, obviously, but
Yeah.
both occurred at the same time. And there's some differences too, right? I mean,
No, well, absolutely. I mean, jalapenos are a very different product than lettuce. They're not as widely consumed. They're consumed as an ingredient in other things, and the distribution pattern is really driving a lot of the differences in sort of where illnesses occurred, and how many illnesses occurred. But
right.
it's a much lower volume product production, so that limits sort of the scale of the outbreak that could occur.
And Craig, how about the potential differences in the source of the pathogens themselves, right?
Yeah, well, the salmonella that was associated with jalapeno peppers, Salmonella javiana, is an organism that is frequently considered more of an environmental strain of salmonella. It can be carried by reptiles and amphibians. It can persist in soil and water in the environment. And, so it was probably present in or around the growing region. And for whatever reason, there was some type of an event or events that led to the contamination
Mm,
of the
yeah.
peppers themselves. And so that's very different from Cyclospora, which is strictly a human pathogen as we understand it. And so the source of our cyclospora infections is always going to relate to people, and then, how soil contamination leads to water contamination,
Right.
which then leads to product contamination.
Right. That's fascinating. And this is why we have to do good root cause investigations to
Yes.
understand the source and the route of contamination, which could be very different in some of these outbreaks, and you just can't draw similar conclusions. Craig, let's pivot to surveillance or response because there's been a lot of what I call Monday morning quarterbacking this year, just saying, "Hey, these signals occurred pretty early." We were seeing a surge in cases in Michigan. I think early July, and we didn't see the first advisory and recall. I think to July
Yeah.
16th or 17th. In all fairness, that seems pretty lengthy. What was your interpretation on our ability to do surveillance and response? Was it fast enough? And you can take what I call a
Yeah.
constructively critical lens. Let me be clear, Craig. I always say there's constructive criticism and there's destructive
Right.
criticism. Not
Yeah. Yeah.
interested in the destructive. I know you
Yeah.
don't play
Yeah.
that
Yeah.
game either, but constructively, what do you think about that? It was a long timeline.
It was a long timeline. With Cyclospora, the incubation period can be up to 2 weeks.
Yeah.
In a lot of outbreaks, the sort of the median incubation period is about 7 days, but it can be up to 2 weeks. And because when people get sick with Cyclospora, they tend not to have a lot of fever and other symptoms. It's diarrhea that's been characterized as explosive diarrhea. It may be recurrent. But one of the things we see with Cyclospora is that people don't actually go in as quickly to get examined as they might with salmonella or one of the foodborne illnesses that cause more sort of constitutional symptoms. And so there's always a longer delay in when people get in to see a physician, and then when the testing gets done, that sort of slows down the reporting process. What CDC has been reporting with the sort of the multi-state outbreak that was associated with lettuce was that the first cases start occurring toward the end of June, like June 22nd, 23rd. And, a lot of those cases are in Michigan. And actually, so from the point of onset in sort of around the 22nd, as cases start to get reported to the health department, they reportedly, the Michigan officials, started reaching out to Taco Bell around July 1st. That's a period, not much more than a week following when cases really start to occur. That's pretty quick.
Okay.
So that means that the Michigan health officials were really on top of following up with cases as they began to get reported and doing investigation and seeing that there was a signal there that said something is going on, likely involving exposure at Taco Bell restaurants. So that actually is pretty quick. Now, because the incubation period is rather can be up to 2 weeks, when we're interviewing people who might have cyclospora to see where those exposures occur, we're collecting data over a period of approximately 2-week exposure window. And we're typically, asking people about foods they ate, 2 to 3 weeks ago. So, to come up with a signal that quickly, I think is pretty impressive, actually.
The signal is impressive, but let me challenge you a little, Craig. But the action,
Yes.
that didn't occur until July 16th,
Right.
2 weeks later.
Well, there was action occurring before the recall happened. And actually, one of the things that we see happening a lot in outbreaks is by the time a recall occurs, most of the illnesses have actually occurred beforehand. And so between when that initial contact with Taco Bell from the Michigan authorities occurred and the recall occurred, there's a lot of steps to try to get a better sense for, what are the specific produce items that are moving through this restaurant chain that could be the source of this contamination, and where did those come from?
Right.
And, I don't have inside information
Right.
on sort of what the process of that was, but, it all starts with, looking at what went into the back of the kitchen at that restaurant and then working back through the distribution system to try to identify the source of the
Right.
exposure.
Right.
Companies like, Taco Bell are fairly sophisticated in their ability to look at their distribution chain and you sort of rapidly, work back through the system to see, where some commonalities might occur. How quickly that happened or who else was involved in it. At some point, FDA gets involved in
Right.
in sort of working with public health officials to sort of look at the trace back information, and they have their own teams of people who are sort of following up and trying to establish what product moved through the system at different times to be able to help guide their judgment about what needs to be recalled. Reestablishing sort of who was doing what when, again, will be one of the things that will help us understand how to do these things better, faster. But, this certainly is related to the traceability rule that
Yeah.
was supposed to be part of the Food Safety Modernization Act, and which was, passed in 2011, and the administration recently delayed trying to implement that
Right.
until 2028.
Yeah.
So the speed with which we can process information across a food chain may limit our ability to identify foods and get them out of the marketplace.
Right. Yeah. That's I'm glad that you mentioned traceability. And let's pivot now to that topic. Let's spend a little bit more time on it. I think you know that I went to the agency for a variety of reasons, the honor and privilege of getting to serve the American people. But one of the things that I wanted to do was finalize that food traceability rule. It was sitting at FDA stuck because two consumer groups had sued the FDA for not writing it. Nothing was happening. And, we were fortunate. I'm grateful for the men and women that helped while I was there to unlock that, get the lawsuit settled, get the rule completed, both in a proposed rule and then a final rule. And then before I left the agency, we had a compliance date of January 2026. But as you said, it's been delayed. But there's a lot of debate on the rule, Craig, and one of the things I really want to explore with you is folks that push back or say, hey, food traceability is not about prevention, and so we'd rather be focused on prevention, or food traceability doesn't or wouldn't make a difference in outbreak investigations. With all due respect, I think some of these individuals have never had to sit in your chair or the chair that I was in and do these outbreak investigations. They're hard to do, and the traceback in particular is very cumbersome because of the way records are kept. And I know when you came and did the foodborne outbreak improvement plan at FDA, there are a couple of themes. One I already mentioned, hey, we need to get better, just in general, everyone, on doing root cause investigations. You also recommended, hey, that we need to continue to advance food traceability. And I remember you talking to me saying the importance of traceability in the investigational process. I think people
Mhm.
forget that. They just think
Yes.
traceback is, the food vehicle and you're going to trace it back to source. But if you could explain why traceability is so important in the investigational process to solidify the hypothesis that
Right.
epi might give you, number one, A, B, really focus on that aspect, and then maybe explain to the audience. And then the second part of how you use traceability is to trace back the source, because they're two very distinct
Yeah.
concepts.
Yeah. Well, it in our current way we do investigations, and my colleagues at the Minnesota Department of Health are really the best at doing this. But we'll try to interview people, find out what they ate during the period of time when they were being exposed, and then to try to collect information to figure out where that came from. Now, in both the Cyclospora outbreak associated with lettuce at Taco Bell and in the jalapeno outbreak involving a couple different chains of restaurants, we have, food items that are complex. They have multiple different ingredients. And so in the jalapeno outbreak, my colleagues at the Minnesota Department of Health, were interviewing cases with the strain of salmonella,
Hmm.
and they were getting a signal that said that this particular type of food item seems to be associated with the occurrence of this illness. But the food item was complex. It had multiple ingredients. And in their investigation, they couldn't distinguish which of those ingredients was a likely cause, for the outbreak. Then, as additional cases in other places get recognized, looking at, where those restaurants were, what the distribution system for getting food items and ingredients into those restaurants, we can begin to say that this particular ingredient was distributed in a pattern that matches the distribution of those restaurants, and other ones weren't. So in fact, the traceability, the trace back of the individual ingredients is what allowed the investigators to conclude that it was jalapenos and not several of the other things that were common to some of
Right.
the food items. And so without having that traceback information, it wouldn't really be possible to say it was the jalapenos at all that was the cause of that outbreak. And similarly, that was what helped drive the determination that it was lettuce
Right.
moving through the distribution system associated with Cyclospora. So our traceback is an inherent part of our epidemiologic investigation.
So that's what I've heard you refer to as investigational
Yeah,
traceback. You're doing the traceback to strengthen the hypothesis or to identify which of multiple
right.
food vehicles might be the source of illnesses. And
Exactly right.
after that, then you want to, we feel confident it's the jalapenos or we feel confident it's the lettuce. Then you want to do trace back through the entire food continuum
Yeah.
to
Right.
determine
So
where did it
so
originate from.
where it originated, and ultimately that can also help looking forward. For once you identify what the product is, you can see where else it was distributed, where people might not have recognized that there was a problem, that could also lead to further prevention efforts to make sure that product is coming off of the market if it's still out there. So really, it does both of those things. It allows us to identify that this food item was the source of the illness, and it allows us to identify what that source was so that we can really determine what the nature of the contamination event was.
I appreciate you, Craig, explaining that because I think sometimes people think traceability is just tracing a foods back to source, but the critical role it plays in identifying a suspect food vehicle, and especially in the types of
Yeah.
outbreaks that we saw this summer, where there's multiple vehicles. If you interview people that have eaten at Mexican restaurants, they're all of them are going to say they've eaten lettuce,
Yeah.
they've eaten onions, they've
Right.
eaten jalapenos, or a large percentage of them.
Or
So,
tomatoes, right. Yeah.
and tomatoes. So, which one can it be? And then you start looking, well, based where the cluster of illnesses have occurred, or restaurants or retail
Right.
establishments, distribution of those ingredients under suspicion, you get convergence.
Right. And going back to your summer of salmonella and
Yeah,
along
2008.
yes, and it was really that was one of the things that really helped sort out that it wasn't tomatoes that was the
Right.
cause of the outbreak, because tomatoes were coming from multiple different places.
Yeah.
And then, once people started looking at jalapenos, and there were actually two varieties of peppers involved that summer, though that converged on a
Right.
common source.
Yeah. Yeah. Well, thank you for saying that publicly, because I've said it too. It was never the Roma tomatoes. We got it wrong.
Right.
But, a lot of officials at that time would say, well, maybe it was both. And Florida Roma tomato growers, as you know, sued the federal government, but
Yeah.
you generally don't win the lawsuit in court against the federal government. But traceability, I mean, had we looked stronger and had traceability records been available more quickly, maybe the summer of 2008 it wouldn't have been so memorable for me.
No.
All right, but that's good discussion on traceability and how critical it really is. And I appreciate you bringing up the rule. Congress has deferred funding for FDA to work on this until July of 2028, but better traceability can't wait. And I don't know about you, Craig. I mean, when people say it's not about prevention, it does have a prevention component, does
Yeah,
it?
it's all about prevention. I mean, our surveillance for foodborne illnesses, we have relatively limited ability to, in most outbreaks, identify and pull food off of the market in a way that will prevent additional illnesses. That does happen, with shelf-stable items or frozen foods. We had back in 1994, we had a big outbreak of salmonella associated with ice cream.
Yeah, I remember that one.
If we hadn't identified that, that ice cream could have stayed on the market for months
Yeah,
and continuously expose people. So there is a direct prevention that occurs as a result of some of these interventions. But what we really want to get to is primary prevention. And
right,
it's by learning these root causes that we then work with industry on the primary prevention methods.
right.
And that only comes as a result of our detailed outbreak investigations.
Yeah, and if you don't have traceability where you can get back to source, you can never do an effective root cause. And if you
No,
can't get there timely enough, if you arrive at the scene a month later, for example,
right, right.
what are you gonna find? Is that gonna be representative of what happened?
No, it
No.
it typically isn't. So that is the constant challenge with foodborne outbreaks, and we really need to think of foodborne outbreaks as public health emergencies,
Right.
and then treat them with a sense of urgency that comes with that.
I appreciate that. And Craig, I know you are on a podcast with me about the creation of a national foodborne outbreak investigation board. Maybe at a later date, I'll bring you back. But, we treat airline disasters with a sense of urgency
Mhm.
with the National Transportation Safety Board. I think you know my view. I think we need to do the same thing. I agree with you on outbreaks. Hey, let's close this. Every time I get on the phone with you, I could spend hours and hours talking about food safety and learning from you, because you've investigated so many outbreaks over the years. Like I said, Minnesota has been a role model for so many other states and even the country. Let's close. I always like to say on these podcasts, they're interesting conversations. I always learn from them. I'm sure the audience does too. We have fascinating guests such as yourself. But I always say, we're not doing this just to satisfy intellectual curiosity or to be entertained. There's enough on TV for entertainment. This is really about a call to action. What can we learn and what can listeners do differently? Now, some listeners will say, well, Yiannas, this was heavily produce focused and I don't produce produce, but I think there's lessons learned often just in outbreaks in general that can apply to a variety of different food producers and regulators. But Craig, I'm hoping, you said that 2026 has been a significant summer. I call it a milestone event. Just like in the early 2000s, we had these milestone events of melamine and pet food, and we had salmonella and peanut butter, E. coli and spinach. They led for a wake-up call for the nation to say, hey, we got to strengthen prevention, and people rallied around Food Safety Modernization Act. I'm hoping the summer of 2026 is a warning sign. It was a big tremor. It was actually a bit of an earthquake. And people start saying, well, what is it that we have to do differently? What do you hope we learn from the summer of 2026 going forward? And what advice do you have to listeners on things they should do differently after this summer is over so that we can prevent future outbreaks?
Yeah. Well, my first focus is always on our surveillance system, Frank. We need to invest more in the ability of our state, local, and federal agencies to be in a position to rapidly respond to events like this. We need to have resources at the state level and at the local level to do the primary interviews with cases. There's a lot of competing priorities that local agencies have. If you have an outbreak of Cyclospora, but you're also dealing with an outbreak of measles, where do you bring people to do those investigations? So we need adequate staffing of our public health system to be able to do this. We need adequate resources at CDC to provide the reference facilities that support that work at the state and local level. And so that's a big thing. As far as food producers need to think about, one of the key things is that when you get contacted from public health officials that something is going on, that information has to be acted on very quickly. And we need to engage sort of our best teams to be able to begin to really process what those signals are and act on them. And in terms of, food production systems, it takes a lot of individual steps to make sure that food is being produced safely. Most of the safety principles are pretty well known across industry, but making sure that things get done the right way every day is a great challenge. And I think that's one of the big lessons that we have to learn here is that there are no shortcuts in making food safe.
Okay, cool. I like those. They're worth just recapping here, Craig. I appreciate it. What I heard you say is number one, we need to continue to invest in public health surveillance, both at the state and federal level. And you can't improve food safety in a nation without good foodborne disease surveillance.
No.
There was a day when Food Safety News, Marler used to have an article, if you had a magic wand. And if I said I had a magic wand, I would continue to invest millions and millions, if not hundreds of millions of dollars in public health surveillance. Because what I've seen over the course of my career, Craig, is that when public health has made the invisible visible, when we've known that certain food vehicles were associated with certain pathogens that caused illnesses, that's when I was in the private sector, that's what got our attention. And we said, well, we need to work on this, and we need to do our own risk assessment. We've got to think about how do we implement controls. And I actually think public health surveillance has done more to advance food safety, things like pulsed field jelly electrophoresis and whole genome sequence, than any law. That's Frank Yiannas' personal belief. So I agree with you. And, we often talk about investing in the nation's infrastructure, whether it's highways and bridges. Well, public health is infrastructure for the nation.
Absolutely.
So all of us have a role to play in advocating to our politicians to continue to invest in public health surveillance, both at the state. And you heard the stories. They were tragic. And at Michigan, they were overwhelmed, right? They had to pull people because they had cuts in funding and they had to lay people off. And so that response might have gone a little bit faster, not to be critical. But if you've cut back and if you don't have people, it's not going to go as fast as it could. But the second point you made, I think, is really sharp, and I hope our listeners are tuning into this, which is that public-private collaboration. And Craig, I don't know about you, I've been in both seats. As a regulator, I love it if a retail establishment or a food service company can tell me, hey, based on the signals you've given me, based on the line listings you've given me, my hypothesis of the 3 ingredients you're concerned about, it's ingredient A.
Right.
Because my traceback records say this is the only one there's convergence on. Right? We love that, right? Thank you for cooperating with us and helping pull that product off the market quickly. And then the third thing I heard you say is just we have to execute with precision. And I know that's hard and the details matter. Have a good risk assessment. Make sure you have effective controls. And you've used this phrase a couple of times in today's podcast that I really loved hearing is, and execute the right way every day. And so those are great points of advice for the listeners. Craig, I appreciate the work that you're doing, the work that you've done, how you've taught and trained so many foodborne investigators, continue to work with the private sector, and continue to emphasize root cause analysis and traceability. It's always a pleasure talking to you. Let's hope that we do learn lessons from the summer of 2026 and that we use them to prevent the next outbreak. Thanks, Craig. Really appreciate you coming on.
My pleasure. Thanks, Frank.
Well, that's a wrap. Thank you for joining us. As I think about the summer of 2026, I keep coming back to this one idea. Preventable outbreaks, when over, should never be just an ending. They should be a starting point for continued improvement through the lessons we've learned. Cyclospora and Salmonella are very different pathogens, but the outbreaks they cause and the investigations surrounding them raise some fair and legitimate questions, I believe. What can we do to further strengthen prevention and prevent reoccurrences? Did our surveillance systems give us enough information when we needed, and was it soon enough? Could we connect illnesses to affected food vehicles faster? And could we trace that food back to its source more efficiently and precisely? And once we knew enough information to act, did we communicate clearly, credibly, and decisively with consumers so they knew which foods to avoid and which ones were safe to eat? These aren't just technical questions. They go directly to the heart of public health and to public trust. All of those are important questions for continued improvement, because after all, that's what smarter food safety is all about. As we close today's session, think about this. We shouldn't wait for the next summer of outbreaks to start making improvements. Let's start making them right now. If the summer of 2026 was a warning, let's make sure we listen to it. Let's turn hindsight into foresight and the lessons learned into preventive action. Thanks for listening to the Smarter Food Safety Podcast. If you enjoyed today's conversation, please subscribe on YouTube, Spotify, or Apple Podcasts. Together, we're going to continue to help create a safer and smarter food system, one that benefits food producers, regulators, but most importantly, remember, all of our bosses, the consumer. This is Frank Yiannas signing off for now. We'll talk again soon, and until then, be safe.